All right, everybody, back in action. You like that energy drink?
It's awful.
No, that was a delicious one.
It's terrible. I thought it was Sour Patch. It's not.
Yeah, they're delicious. It's like Sprite with a gunshot. That's how I think of that one. Yeah, well, welcome to the episode. We've spent a minute since we've kind of talked with some of the industry updates and changes, and there's been a lot of movement starting to happen in the background as far as potential changes from the Medicare industry, with the new administration coming in. By the way, YouTube, you suck. Your censors, we can't say anything without getting censored still. You're the only ones doing it. You suck, you suck, you suck.
You suck, you suck, you suck.
Yeah, and if anybody else is on X, that's where we found we can just post the uncut versions of this, and so you can
have to bleep out keywords. It's ridiculous.
So you can always watch the uncut versions on X.
So it's going to be hard to talk about what we want to talk about today without knowing we're going to get censored by the YouTube Google overlords. But there's been some things happening in the background, starting to kind of the picture coming into play a little bit with what may happen with some of the landscape. So we want to talk about a few things that we know, a few things that have been lingering over the past few months and year that have been unattended to or unresolved.
Yeah.
So I think we wanted to start about talking this week. There was a small update to what I would have considered one of the biggest threats or changes to our industry last year, which was the overall FMO override compensation last year component. So if you were kind of following that, Integrity and AmeriLife had basically filed against CMS, challenging the ruling that there was a look to consolidate FMO commissions and essentially add that extra $100 in compensation to agents' comp and then consider that as services. So it was essentially maybe the end of FMO overrides or compensation, correct?
Right.
So,
well, I was just going to say, my position on all that, just from a broader perspective that I want to kind of more talk about was, running a business or running a budget or anything else, it just never really made that much sense. And look, people will probably push back on, my position on this, but when you look at the way a Medicare Advantage plan, for example, is funded, because a lot of it was really about brokers and distributors who were selling Medicare Advantage, right? It was more about that than it was the MedSup or PDPs or other product lines. But when you're really looking at the way MLRs work, and it's this 85-15, where 85 cents on the dollar has to go to the actual product, into the actual plan, and only 15 cents on the dollar can go to admin, expenses, including commissions and everything else. Whenever you're running large budgets like that, you're not going to go, oh, I need to sharpen the pencil. Let me go cut at that 1% of my fees. You're looking in those larger cost centers in those larger areas. So I think that was, a little misguided anyhow, because when you're really looking at the whole ecosystem of creating a product from scratch with actuaries to your filings with CMS, to your go-to-market strategy where the rubber hits the road and a policy is sold, that broker commission or FMO commission was a drop in the bucket in the overall big scheme of things. So I think I don't want to really go too deep to say it was all a lot of posturing or grandstanding or anything else. People had motives and reasonings behind it. But, if it were me and I was looking at where can I get cost savings, it wouldn't have been there.
Well, that's basically the update that we wanted to give is there was an update from technically a conservative leaning judge where one of the court cases was filed in Texas, and his read on it was essentially suggesting a summary judgment in favor of CMS, which a lot of people were trying to interpret that as saying, well, it sounds like even a conservative judge that was a appointee is siding with CMS, and that is going to happen, that's still a potential threat to the industry as far as changing the FMO comp or doing it as CMS suggested. And I think our take on it is, well, yeah, I mean, the judge may be saying that CMS has the right and the authority to do so with the current change in the administration and the tone and direction of the CMS administration coming in. That's very unlikely to happen in that way. And to Dan's point, what he's saying is, if you believe some of these numbers that have been coming out by these estimations of Doge and things like that, where they're saying that Medicare and Medicaid have maybe overpaid or had fraud, waste, and abuse to the tune of $2.7 trillion since 2003, agent and broker compensation as a total part of this equation is a very, very small component to that. And I'd be very, very surprised if agent and FMO comp is identified as a major driver in this whole healthcare cost. It was kind of like...
I would even add to it and just say that I even think that, the more that this became a talking point and a friction point and really had a spotlight put on it over the last year, where, you had regulators and everybody else really keying in on, broker compensation and FMO compensation. I think if anything, the more people who are very pragmatic and looked at it, understood that, the brokers and even the FMOs are not the villains of the industry. And ultimately, I don't think that the message has been that, yep, we got to lean in harder and make sure and restrict or take those away, because it's an entire part of a supply chain and ecosystem that most of those smart individuals really understand. And to kind of rip that whole ecosystem apart and rebuild it would be far more expensive. I mean, we may have some different guardrails or rules or something behind it, but I am really, even more so now, firmly of the belief that if anything, compensation is either going to be enhanced or be very solid for the next foreseeable future. When it comes to broker pay and FMO or distributor comp, I'm highly confident in the matter.
Agreed. I mean, the residual effect of all of that potentially happening, every carrier had contingency plans in place where they knew that they can't exist and live without FMOs and brokers.
I also even want to kind of say it was kind of the old effect that I always joke about with like a magician or sleight of hand, where it was like, look at what the right hand is doing so you don't see what the left hand is doing.
Yeah, exactly.
And I almost continue to say that whole entire saga from last year was, look at all this little percentage that's going on over here so that you don't see a lot of these bigger problems over there. Like that's my take on it.
Correct. And where things are kind of a bigger picture is coming into play overall is we're seeing administrative costs in the healthcare sector have far exceeded and outpaced growth, cost of care, and the funding environment has not been adequate as well. And so like Dan's saying, it's a little bit of like, well, don't dig into the big problems over here. Let's look at what all these brokers are making and all these FMOs. And it's like, hey, we're an important piece of the equation there. We're a very overall undercompensated, I feel like, component of the industry for the services that we deliver. And then maybe this was something I wanted to talk about later on in
Navigators.
the episode. Yeah, but if you compare and contrast that with the one of the executive orders essentially stripped down, we've talked about it before that the prior administration had budgeted $100 million for the expansion of healthcare navigators.
To ramp them up,
To ramp them up over the next 5 years. And part of the executive order slashed that spending instantly down to $10 million. So you look at the compare and contrast of the two things going on in the industry, even very, very early on, and you go, well, CMS is obviously cutting that allocation for navigators. That those two things can't really exist. You can't eliminate and kind of squeeze out the broker compensation and the FMO overrides and cut the navigators. I think that more than anything signals a shift that
philosophically, that the dollars are going to be spent and invested into the current kind of supply chain and ecosystem that already exists with the broker and agent community and FMOs and distribution. That's where the money is going to go to, not increasing, tax dollars and putting that into more government staffing or, grants or budgets allocated to navigators. So yeah, you're right. So the navigators for the most part are going away. And a lot of those, it turns out, were contractors, were not necessarily government employees. They were contractors. So I've already heard rumors that they were, pretty just immediately cut off, and a lot of those navigators are already done. And at the same time, I mean, what was a navigator doing? A consumer was calling in. They were pulling up by their zip code. They were looking at available plan options available to them and walking them through and guiding them through their selection. It's the same thing that a good broker should be doing, except for that a good broker or agent would be able to receive compensation in perpetuity for servicing and managing that client or that customer. And so in theory, the mechanism was already there. And we already had a solution for it. And so the navigators were just not needed, and I think you're right. It signals that that's kind of more of the direction that things are going to continue to go over the next couple of years.
Yeah. And I think that the initial signals from since we did an episode, RFK was confirmed as the new
You've already said the T word and the RFK, so for sure you're gonna get.
Yeah, well, who knows? If you can't even say acronyms or initials, then we're really into it. But yeah, he's been confirmed as the head of HHS, and kind of along those lines, both he and Oz have considered or are considered to be very bullish on a public-private partnership, and so I think we're going to continue to see the evolution and expansion into programs like Medicare Advantage and things like that. Along those lines, another kind of little piece of news. Dr. Oz, one of the knocks against him or the concern was he's obviously very heavily invested in the pharmaceutical industry and in the healthcare industry. And so he'd agreed essentially to sell or close all his positions, divest out of all of those stocks. So there's no, conflict of interest ahead of time. Nevertheless, it still looks like they're bullish on a public-private partnership.
Yep. So I think that'll be all, it's a very positive signal to those listeners of ours that are, in that space where you're a producer, you're an agent, an agency owner, anything on that side. I think those are all very positive signs. And I would just say that I don't think that there's as much of, again, this is a very unofficial, these are just Dan's thoughts. I don't think that there's really an appetite out there from the current leadership being implemented there at CMS to go after and go pursue broker compensation and FMO compensation. I don't think that appetite is there. So I think that kind of goes away. And I think more the current administration wants to kind of find ways to improve the relationship. And I will say this too, I've already been hearing from a lot of carriers and from industry folks that I know that the folks that are now at CMS are a lot more vocal and communicative. I've already been hearing that, people have already gotten better clarification and guidance from CMS than they have over the last couple of years. I've just heard from a lot that they were getting stonewalled, or they would go back to CMS and ask questions and be like, hey, we understood your document you put out. We understand this mechanism. We have follow-up questions. Can we get clarification on X or Y or Z? I know the states, the NAIC, there was a lot of different entities as well who were trying to get clarification about how quickly things changed and all the new rules and all the new guidelines. And I don't want to say that they were completely shut. It was very hard to get guidance and communication and clarification. And that is one other big thing that I've been hearing. Again, just to not be too repetitive, but a lot of communication and a lot more clarity over the last few weeks. So that's a good thing.
Yeah, in kind of summary, some people have essentially assumed that this ruling related to that court date would kind of reopen the potential for overrides to go away for FMOs, and that agents would receive that additional compensation. If I had to look in my crystal ball, I would think both things are probably going to happen, where we're going to see some.
Well, but this is what we were going to talk about too, is like in the real world, we were just talking about it. It's a vacuum, right? It's like a whole part of the supply chain that exists. So let's just pretend for a hot minute that any of this stuff had gone on, that brokers or FMO comp had been modified or whatever else. You still need a human to go and perform the work and help the consumers and navigate them through these choices. Unfortunately, we have overcomplicated the insurance shopping, buying, selection process here in the country, whether it be individual products or Medicare products. It's quite complicated and convoluted. So there's always going to be a need for somebody to guide a consumer through that process and assist them. So let's just say it had gone away, and then you know what? Agent Boost Marketing, my tax ID would have just filed for like a grant then or something to run a Navigator program. And then instead of, getting paid a commission for selling a product to a consumer, you would essentially go get a grant or get an award for millions and millions of dollars to then say, oh, I don't have agents. We have navigators that help people choose their healthcare decisions. I mean, what really is fundamentally the difference, other than, you actually have more oversight on a broker. You're only paying them if and when they perform the service. And you can oversee a whole lot more compliance. What kind of metrics does the industry get back on a Navigator? Like, how do we quality score all their calls? Is there ramifications? Like, how productive are they? Like, what kind of management and oversight do we have over the Navigator program? I don't know.
And I still feel like most carriers feel like a good broker, a good insurance agent is a really cheap date, so to say. They do a good job for what they're investing in. If you're a good broker, you're helping with the enrollment, right? You're soliciting the business. You're actually performing the enrollment. You're helping with the onboarding.
A lot of times you're doing the marketing and paying the marketing costs and expenses.
Yeah, so you get, essentially you're getting to offload some of the marketing, the acquisition cost, and then the purpose of paying a renewal is to pay for continual service work. And a good broker and agencies, they do that work. And so they take a lot of very expensive, cost prohibitive services off of the carrier and allow the carriers to do what they should be doing, which is be healthcare providers, right? And so as long as we'd been in the industry, that was always the model. And it was generally considered a very good win-win for the consumers. And that was one of the reasons why we've always loved Medicare Advantage, and I've always explained it to agents and even my beneficiaries as a win-win-win-win, right?
Yep.
It's a win. You're taking the pre-allocated tax dollars, the Medicare, the funds that are allocated in the Medicare budget. You're stretching those further with the talent, let private business do what business does, and then the consumer gets more bang for their buck, essentially. And then an agent, if they do a good job, is also able to participate in that. And so you have a really good system that operates very well when those things are firing on all cylinders. It's when any of those things become, kind of out of whack or out of balance that issues come into play. And there are some initial signalings in the industry that the Medicare Advantage model is going to be the preferred model going forward, right? I've even heard rumors that they've talked about essentially auto-enrolling people as they T65 into state contracts. It's almost like the aligned contracts,
right,
that some of these carriers have with these state Medicaid and Medicares for the dual. And I think that would be a really double-edged interesting mechanism, right? As to how brokers play in that. And I would imagine that, of course, not everybody's going to be happy with that. You don't want to just get auto-enrolled into a carrier that doesn't serve your best needs. So I still think there's going to be, I don't think we're going to go that far, right, I guess is what I'm saying.
Well, but then that also comes down to, when you're a consumer and it's your choice and you have your dollar to spend, you have that ability to go buy the services from who you want, where you want, when you want. But, going to your point and talking about subsidized services, when let's just say you're a dual and you're in a fully aligned, state or something like that, and they auto enroll you, well, they can do that more often because it's their dollars, right? It's their program that they're running. If you want to go, outside of that ecosystem and say, hey, I don't want to be with this plan. I don't want to be auto enrolled. Well, you're accepting. You're on a Medicaid, platform. You're low income. You're below the federal poverty level, and I'm not trying to how should I put this? I'm not trying to be sympathetic. People should have their choices, but when you're on a government-run plan, getting government subsidies for it, it's just to be expected that you're not going to have the full litany of choices available to you.
Yeah, the Cadillac plan.
Like another consumer. You know what I mean? So I think there's some expectation that that's normal or should be normalized, I would say. So
yeah, it's been interesting though, because over the past week, 10 days, there's been some of this communication out yet, and it does tend to seem that the overall strategy for solving the funding pressure, the downward pressure that we're seeing in the industry, is first to root out and essentially get rid of all the fraud, waste, and abuse that is in the system, right? And then kind of reallocating a portion of those won-back dollars into properly funding the plan. So I think that's best case scenario, right? I mean, if there's so much spending already into the system and a lot of it is deemed to be inappropriate fraud, waste, or abuse, and we can root out a lot of that and reallocate those dollars, I think we're going to get a lot more bang for the buck for these Medicare plans going forward.
Well, to be clear, I want to, and I go to the Doge website just so that everybody knows, and I try to, for example, like you'll see a tweet, or we still call them tweets.
Whatever.
Do we still call them tweets? I don't know. On X, who knows? But I'll see a post on X from Doge about, hey, found $2 trillion in savings here, found $300 billion here, found $2 billion for condoms for this country, found, they throw out all these things that they found. And then, I always, in my research, like anything, we say trust but verify, right? Like I want to, so then I want to kind of go look at the receipt and the paper trail and see it. And so same thing, just so that everybody knows, we've heard the thing about 2.7 trillion in payments into Medicare and Medicaid of fraud, waste, and abuse, but I've yet to actually see the full report, and I will keep you all posted too, unless you've seen something.
No, specifics on like where are you getting that? What kind of things are those?
Exactly.
Are those?
I want to know exactly, like, okay, you say 2.7 trillion, perfect. Give me like the breakdown. I want to see like a summary report or something like that. I want to see the invoices. I want to see like what the dates were, where the dollars went. And I'm not saying that I believe it, but I, like everything, trust but verify. I want to see those actual dollars and where they went. And is there a possibility that some of those dollars are clawed back or recouped, and can they be reinvested into the program? I think those are all things that, will be really interesting to see over the coming months. It would be wonderful if they somehow even found $1 billion that they, clawed back and were able to, or hundreds of billions of dollars that they were able to reinvest into the program. Then maybe we're not going to be saying, oh boy, that broker, he made an extra $12 on that sale. Boy, that insurance company, we can't reimburse them that star bonus, even though they really did a good job with their HEDIS or CAPS measures. Boy, if we give them a 4.5 star rating, their reimbursement amount's just going to go up, instead of scrutinizing every one of those dollars, they can actually invest it into quality programs. So that would be, ideal. And that's still like, stay tuned, TBD there, but I'm all in favor of the audit and finding the dollars down to the line item.
Yeah. I mean, we've talked ad nauseum about the downward pressure on the funding environment and how it essentially affects everything, right? I mean, obviously if carriers are trying to eke out a margin, they're going to be tightening the bolts on all aspects. They're going to be more stringent on prior auths. They're going to be more stringent on all the purse strings, right? Because they're trying to carve out a profit there.
The other thing I think I want to talk about before I forget, sorry to cut you off, Mike. I also been thinking a lot, just so that everybody knows, like we have podcast notes. We think about the industry. We talk about what's happening. And, I've had a lot of contemplation. I think we work like as an entity, I think we have close to 100 different insurance companies that we have a contract with. That's across all lines with, Medicare, ACA, life annuity, ancillary, whatever. We have about 100 different carriers. And I've had a lot of reflection, though, over the last couple of years, just during this chaos of, plan design and, being able to create, Medicare Advantage plans, administer them, have them be valuable to a consumer, working well with brokers or distributions, getting them to the market. There's some carriers that they're just not good at it, meaning that there's been a lot of carriers who are either local plans that either had like healthcare facilities and they were more of like a network, and then they created their own health plan, or that there's been like regional or smaller players out there, or there's entities who historically made all their money in commercial or group or individual, and they've kind of tried their hand at the Medicare space. Mm-hmm. And I would say that, Medicare products and DSNP in particular, they're very complex and very complicated. And there's really a lot of, I don't want to say science, but so much actuarial work that goes into creating your bids and running a profitable plan. I just think that for a couple of years there, especially during COVID years, where there weren't a lot of checks and balances in the payments, so many companies just wanted to get into the space and create a product. And I don't think that they were really doing the industry any favors, the consumer, the broker, anybody. And so I think that people should have choices, but I think that a lot of those insurance companies out there should take a hard look in the mirror and really decide if they should be in the space or not. And if not, we saw a lot of them exit. I don't say a lot, but we saw several of these companies, kind of roll up their tents and say, we're exiting the Medicare space. I welcome that, in the sense that I don't like the disruption that it causes carriers in the moment, but some of these entities are just not built to do and run a great Medicare Advantage program long term. And I think the more and more that we keep having these challenges, hopefully they're self-identifying this and saying, hey, if we take a hard look in the mirror, where are we going to be at in a year from now or 2 or 3 years from now? And, just kind of do us all a favor and either.
But yeah, we talk about it internally fairly often, and we know carriers, we could name names of carriers that we know are kind of on the tilt, so to say, where they didn't necessarily close up shop last year, but they're hoping for brighter days ahead. And I think they're kind of watching the things we're talking about right now very closely to see if they have some reprieve coming very soon financially.
Right.
And if not, if it's looking like it even might be extending into next year, I think you are going to see a handful more of these smaller and regional carriers that go, this doesn't make sense for us anymore financially.
Yeah, I would say just don't do your bids. Just don't do your bids this year. I mean, because same thing. And I mentioned it on a prior episode too, that this upcoming sales season is not going to be easier. I had a call earlier today with a carrier partner. I had one last week with a carrier partner, and we were having discussions about right now the war games, the bids that are going on, them trying to look at financials. We talked about how challenging which areas and zip codes and counties were going to be suppressed, which ones were going to be non-commissionable, which ones were, and you know what, I hate to say, we're in for more of it this coming year, simply because with the new kind of regime change at HHS and CMS, look, if you've been paying attention to everything going on daily, there's this cut that's happening. We're laying off these federal workers. We're doing all these other things. There seems to be so many agenda items of the new president that I don't know where down the list is, I haven't gotten clarity on the Inflation Reduction Act, and some of the components to it don't seem like they're going to be financially sustainable. When are they going to address that as like a top priority issue? We don't know. So there's so many variables that these carriers are working with right now as far as, is VBID actually going to stick around or not stick around? These financial components all kind of have kind of a question mark to them, and it's not really certain how some of those funding mechanisms are going to work moving forward for 26 and 27. So I just think that it's going to be very financially stressful for a lot of the carriers this upcoming season. More suppression, more non-commissionable, some plan exits, all the above. And so again, it's just going to be hard. And the more that players within the space can kind of self-identify those things and make it easier on all of us, the better off we're going to be.
Yeah, we already know that some of the carriers have already communicated that the time frames of the industry that had pretty much existed as far as war games and then, the national average bid amount and going through NABA and filing benefits and all that kind of stuff, it is going to be much more along the lines of last year, which was atypical than it is a normal year or how it was prior. We already know that, for example, some of the carriers are foregoing or delaying their national rollouts because by now we're already either getting invites to those things. We're already building our calendar for the summer, and some of them have just said, "Hey, we're not doing it, or we're not doing it the way we did before," or they're delaying those things until much later in the summer or early fall. And I think that's just for them to buy themselves as much time to be able to have some sort of something to say to the partners and carriers in the industry at large. And I do think that this year's going to be very important, just like last year was, where the carriers who do a better job of, mitigating the risk, managing the chaos, and who are better prepared, better well-built, are going to probably win again this year. Well,
and I've even been early and often, so to speak, talking to carriers this year to say, hey, be more transparent with us if you can about the areas in which is very sustainable and good to grow in, where we can put dollars, where we can go sell products, where our agents can go be successful. Because the last thing we want to do is go invest, again, those dollars, efforts into a market that is not sustainable, that you're going to be cutting. Why do we want to go through the exercise of enrolling a consumer onto a plan, getting them acclimated to it, having a positive transition onto a health plan, And then at the end of the year, that consumer now has to dump their plan and do a plan change, and the broker has to we don't want to go through that exercise, right? We would rather just focus our efforts in the areas in which those carriers know have a great growth path and trajectory. And the one thing that I tell brokers all the time is, look, a market for one carrier is not, even though the reimbursement dollars are the same from CMS, it's not same, because, a competing carrier might have complete different economic terms, meaning that they might have a better financial arrangement with some of the network there. They might have a 4-star plan getting, higher reimbursement dollars than a 3 or 3.5 star plan. So, one market that might be identified by a carrier is bad for them. The carrier competing across the street, so to speak, it's a great market for them, and they want more business. So we're just trying to have a little more communication as we're forward looking to 2026 and be a little bit more strategic as to where we're putting our time and effort.
Yeah, along those lines of what you'd mentioned with the stars and the funding and all things not being equal, one of the other things that we'd wanted to talk about, kind of a recent thing, was CMS decided not to refile or fight the determination of UHC that the star ratings were improperly calculated and filed. And so I do think that that's going to have residual effects, that CMS is essentially going to back down a little bit on the aggressive nature in which they calculated some of the star ratings, because we saw that pretty much universally across the board, that star ratings were down.
Yeah, which Scan, Elevance, everybody
devoted, everybody
kind of won those lawsuits.
Yeah, well, and everybody had kind of been knocked down a peg. And if you don't really understand the industry, the bonuses for those star ratings are significant. A lot of times they are the difference of if a plan performing well or having to market or being profitable or not.
Well, so you go back to MLRs and you look at, that whole 85-15, and you're looking at profit margins of only a couple percentage points, anywhere from 1% to 3% profitability. And then you build a whole entire plan, and you're taking all the risk, and about the only way you're going to make profit or money is if you're hitting those bare bones 3.5, but usually 4-star and above, because it's been designed that way, right? It's been created that way to where if you're doing a poor job, you get less money. And the only way you're compensated more is merit-based, right? And it's meritocracy. And if you're doing a great job, then you're getting those bonuses. And sometimes those star quality bonuses were essentially kind of modeled out to be almost the entire kind of profit.
Correct. And if you're an insurer, if you're eking out a 3 to 5% profit on that business, you're doing very, very well, right? And nobody feels bad for any of these massive health insurance companies. And, it's been very common to hate on the evil insurers lately. But when things are going well and they're executing well and they're making even a few percentage points of profit, is a lot of money. But the same thing works in reverse, right? When these carriers have the financial equation go negative and they're not profitable and the money's upside down, they also lose a lot of money very quickly, right? And businesses don't generally like to lose money, right? So that's when...
Well, but not only that, a business owner doesn't like to put, a business or an entity doesn't like to go put in $1 billion of capital for the upside to make $5 million.
Correct.
They're not going to go do that and stake that much risk in capital for such a small and little return.
Yeah, and so it makes it really difficult to even kind of gut it out financially in a lot of these equations, and that's what's led us to an unprecedented situation with Elevance and WellCare in some areas and some of these other areas where they've really suppressed a lot of their plans and gone non-commissionable and that in my opinion has caused a lot of chaos too. And we sit and we strategize from a national level, and we have great carrier partners, WellCare, Humana, United, all these carriers, and we go, well, where do you want to grow? Because they don't want to grow in all the areas across the country. And so you have to be sophisticated as an entity to be able to grow where it makes sense.
There's a common trend in some of the states they don't want to grow in. I don't want to say it here, but there's a common theme behind some of the states that are extremely challenging for them to do business and make a profit in.
Yeah, and then you hear rumors of, I'm like, are you sure you want to Are you sure that's a state that you want to go do work in, that you want to try to grow and expand in? Because I don't know if you've seen the history, but you're going to have to really overly execute there and outdo all of your competitors, because that's not such a great one.
You're like, I don't know how you guys modeled this out, but I'm looking at year 7 before you turn to be in the black there.
It reminds me of, everybody knows in your town or your area where there's like a retail space or like a restaurant where no matter what goes in there, it always goes out of business a few months later. It's like those cursed spaces, right? And that's how I feel like some of these counties are and states are.
It's a good analogy, because you know exactly what it is. It's like basically some determination of traffic in that retail space, or it's like part of some other like entertainment complex or whatever it may be. And like price per foot on rent is too high or whatever that may be. And you're right. And it's just that nobody can make a profit.
And then it gets
there.
that stink of failure on it. And you just like, that's the 6th restaurant that's been there in 7 years. I'm not going to even try it.
Right.
That's kind of how some of these states and counties are with some of these insurers.
I know. And I
don't want
to name names and states or areas.
Just ask us.
But yeah, there's certain areas where I'm just like, they're like, hey, Agent Boost, what about we really need to grow in this area? And I'm like, what else you got for me?
Yeah.
Pass.
You're like, and good luck with that.
Yeah, exactly. So
yeah, there's that. I do think overall, because people keep asking, the tone is not to cut any Medicare benefits, right? And that's been said pretty consistently. I do think back to the 2.7 trillion supposedly in fraud, waste, and abuse, where we're saying, well, where is that from? I think it's probably a mixture of all that, right? There's probably a lot of really egregious big entities that are committing fraud and full on stealing money from the taxpayers. There's probably a good portion of that more gets categorized as waste and abuse, and we think of those trainings that we do, and it's like, what's this an example of? And you're like, nope, that's waste.
Yeah, there's probably just overpayments. There's probably incorrect payments. There's probably a whole litany of different things and categorizations. But, again, going back to having like let's just kind of be critical thinkers. Let's be very, common sense people. And again, like, what are the things that you're going to eliminate? That's what I've tried to tell everybody. Look, we try to stay very, I at least think that we do a good job of trying to stay very politically neutral. As a company and on the podcast too, but regardless of who's in control of our government, you always want to say that you want them to be efficient. You want them to do a good job with taxpayer dollars and to be effective. And just in general, government has never been known to be highly efficient with innovation, with technology, with...
You mean going down to a mine and having to get the paperwork out of the mine so people can retire isn't known as being
Dude,
effective
I thought
or
that
efficient?
was a scam. I completely thought that was like clickbait, and I went down a whole rabbit hole on that. Like, what? This is
You're like,
real.
that sounds like a great idea
This
in
is
1956.
Real. Whoa. Yeah, and it's like, dude, how could you not just like have like a triple backed up server and just... Anyways, I could go into... a whole other
tangent.
Yeah, they're on that. But I just look at that and I go, it doesn't matter who's in control. You want your government to be efficient. You want them to do a great job with those dollars. And look, we're in a business where we're dealing with products that have government subsidies, whether it be Medicare or whether it be ACA or individual products. So there's always going to be that element. But I would just say too that both sides and parties, whether it be the left or the right, are always pointing the finger as the other side as being the bad guy. Or gal, and that they're evil and that they're the best. Their solutions are the ones that are the best. Yours are the worst. There's always going to be that hyper politicization of everything. But I would just tell you that I don't see any appetite or desire to really cut Grandma Smith's benefits. I think they're just wanting to kind of clean up, again, the fraud, waste, and abuse. And I would continue to tell the brokers and the consumers that, don't buy into all the hysteria right now about that. I just don't see any of it happening. I just think there's going to be a lot more stability and efficiency.
Yeah, kind of along those lines. We talked off camera about kind of observing people's behavior on social media.
Fear-mongering.
And you go, you can obviously tell where they stand or where their read is on things politically, and all of a sudden it's Chicken Little, the sky is falling again. And one thing I want to remind everybody, like Dan said, it doesn't matter what side of the political aisle you're on. We've been in this industry now for 16 or so years. Much of that has been with
18 years now for me.
Yeah. I mean, but when we even got in, it's been a lot of leadership. There's been leadership, and now we're back into again. And guess what? We've grown in every year. And so
it ebbs and flows, and there's themes to every. There's like this undertone and a theme of what that regime wants to kind of focus on and improve or essentially accomplish. And you just have to kind of know, where the goalpost is, and you just have to be able to adapt and kind of, game plan your business around it and kind of be ahead of it. Right.
Yeah. And so it doesn't really matter what side of the political spectrum you're on. You need to have an idea or the mindset that you're going to be successful and you're going to grow no matter what. One of the trainings that I do for our agents is it doesn't matter who's in the White House. It matters who's in your house. Right. And I think that's really important, even for business owners and other industry professionals to remember is, well, what can you do to be successful in your aspect of the business, and how can you keep growing, and how can you keep helping beneficiaries, even if things aren't going the way that you think they should go.
And we talk
ideologically,
right? When we talk to agents too, like, how does this materially affect you? Mm-hmm. Does this materially make a change in how you? Those are the things that we want to focus on, right? About, okay, is this a policy or something that's happening that's going to change the way you're paid or what you can or can't do? Things that are big material changes that I said to brokers were like call recordings. That's like a big change that, obviously is going to impact how you're doing business. That's a perfect example of it. If there's a TPMO disclaimer that now you have to say at the front of the call or put on advertising pieces that you're doing in the marketplace, like that's a big change that's going to impact that you need to implement, you need to spend dollars and do into your business. But then there's other things that happen that's just noise, right? Mm-hmm. It's just rhetoric. It doesn't really impact your business. And those are the things that you should not let distract you. And you should just focus on the things that actually are going to materially change your business.
Yeah. And so much of the noise is hyperbole, right? Everybody's always like, oh, this person wants to take, everybody wants to take grandma's medications and grandma's health care. And according to one person, the other side of the aisle wants to leave those people with no health insurance destitute, depending on who you talk to in the time of the political season.
Just throw them in Guantanamo.
Yeah. And the reality is that everybody in America wants to have good health care. Everybody wants to be able to go see a doctor in a situation. Nobody wants to be left out in the street to die if you get a cancer or critical illness or things like that. It doesn't matter if, you're an R or a D or whatever, you want good health care.
Yeah. The other thing I would just probably allude to, since we're kind of, I guess from a topic perspective of this podcast, I'm easy to derail, but we're kind of talking about like the tone of everything and updates and industry changes. But I would also say that, there's been proposals in the past couple of years to almost gear and enhance more services going towards like a PACE plan. We saw for a hot minute that there were some Senate plans out there that had, gained a lot of traction that were good with some other services. We had a lot more dollars thrown around into the plans where they could do more with it. I would almost just say too, setting the table for what, if I'm a broker or an agency, what do I expect this coming year, the year after that? I wouldn't expect tons of enhancements. If you're not kind of reading the room, the tone has been, let's cut excess spending and let's be efficient with dollars. Let's try to get out of debt. That's really the tone of this administration. And so nice to have ideas, things like enhancing and doing long-term care by Medicare, more and more enhanced mental health services, more and more, anyways, there's always proposals out there. I'm not saying that those aren't good ideas and that people shouldn't have those things, not at all. But the money is the money, and there's only so many dollars out there. And I just see that a lot of those kind of nice to have proposals and ideas that were, kind of circulating around there for a few years, I think a lot of those are dead, and I don't really see those picking up a lot of traction as far as being kind of bolted on or adopted into Medicare Advantage programs over the coming years, because I just don't think they're going to find the dollars for it. So.
Yeah, I mean, I think as we've gone through two difficult years financially, and it's continuing. One of the good things is innovation, right? And the industry, the healthcare industry itself, providers, doctors, hospital networks, they're all trying to figure out ways to increase their profitability as well, to be more efficient. And ultimately, I think difficult times lead to more innovation.
Sure.
And I'm watching a lot of the things happening on the provider side of things and the healthcare side of things. And I do think we're going to get smarter. We're finally at a time where there are automations, there's technology. It's easier and quicker to build SaaS type solutions and automations that are eliminating out a lot of inefficiencies in the industry. And I think that we're going to see, that's one way that we're going to see the healthcare industry lower costs on their end, is on the administration side, on the management side, and using tech and AI and things like that. And I think that's going to,
and then you're going to have the introduction of like the ethics of using certain elements of AI and things within healthcare. And that's going to kind of creep in and be a part of the conversation too.
Correct. And then I think we're also, just talking about tone and what's happening, the MAHA movement, right? I think you are going to see some more incentives financially built into plans and carriers in healthcare.
What is that? The Make America Healthy again?
Yeah.
I'm behind on the acronyms.
Dude, your wife would slap the side of your face if you didn't know what MAHA was. But yeah, the Make America Healthy initiative, where I do think that that's going to come in and...
Hey, I know the food is medicine thing.
Yeah, exactly. And I think those things, if they work and that they can be implemented properly, should drive down some costs, on the overall system. And then you have the aspect of, targeting and eliminating legitimate fraud, waste, and abuse. If you can actually execute on that as an overall overarching game plan, I think we can get, the healthcare system and these plans, back on track.
Since you're on topic there, I would say that I've already seen proposals from some states, from their Medicaid, again, going back to state rights and everything. I've already seen states starting to announce that they're going to limit and restrict food that's available through WIC
and SNAP,
and SNAP, and so food stamps. So essentially, what was happening before is people could go and buy their 6-pack of their 12 packs of Mountain Dew and whatever other crap they wanted to buy. And I have heard that some states are already starting to rein in and dial in what is being allowed to be purchased, with those food stamps or SNAP. And I would not be surprised if we started to see similar restrictions with, the grocery cards with Medicare Advantage, and, what those things can actually be used for. And it has to probably be healthy, nutritious food, because that was the kind of the intent behind it, is if people can eat, you are what you eat. And if you're ingesting good, healthy, nutritious food, then your health's going to be good. It wasn't always intended to buy, junk crap food. So.
I remember my first interaction with that. I was in Philadelphia, and somebody went to pay for something with their SNAP card, and they had a bottle of NyQuil. They had a bottle of NyQuil, and they had 3 giant bags of M&Ms. And the lady was like, "No, you can't pay for the medicine, the NyQuil, with the SNAP card. You has to be the food." And so the person needed medicine, NyQuil, couldn't get covered by the SNAP card, but the 3 bags of M&Ms were covered by it. And I was like,
"We're good to go."
What the hell? Are you serious? Is that really how we do it?
Yep.
And so I think that's already been.
Well, dude, how often do you go and they have everything, and then like their beer is to the side, and they're like, I got to come out of pocket for the beer.
I've had clients that, back when the early days of the OTC cards weren't monitored very well. I had a client that had a whole storage of Pepsi in the garage, and I was like, "How do you?" He's like, "Yeah, I buy it with this card at Walgreens." And I'm like, I don't think that's the way that's supposed to go.
It's intended. Yeah, I wouldn't be shocked if we see more restrictions as far as if there's going to be funding there for it, like what people can.
Yeah, there already is. I mean, they've already passed those executive orders, and I don't know where those are at in the actual implementation. But yeah, there's definitely a lot of stuff that's been changed, swirling around by pen, and it'll be interesting to see how it all kind of lands and what takes and what ends up being codified and what ends up actually making its way into the long-term way that we do business with Medicare and Advantage. And
The other thing that we want to maybe talk about before we wrap too is just talking about what's kind of changed is, kind of bigger news. It's been talked about. One state, well, I'll call two states in specifically. There's been more Medicaid disruption too over the last few months where, for example, Kentucky, I'll call out, it's not like a big secret now, but Anthem or Elevance lost their state contract for Medicaid there. And so they lost their dual plan there. There was about 30,000 lives that were impacted by that, and it's not like during AEP. It's just now happening where they're losing that contract, and so there's a lot of disruption happening there in Kentucky. Another one, Idaho, Blue Cross of Idaho lost their state contract, and that's an integrated. That's a Heidi-Fighty state.
Well, and they decided not even to carry it out through the end of the year. They're just like
June.
Pack it in.
Yeah, so I think it's June their contract ends, and so I don't know if consumers yet are getting notified. Brokers certainly are, and so they're no longer commissionable, shutting that down mid-year. So I would say, too, there's going to be a little bit more disruption. You're going to hear some other states like that with some CAID contracts, with some mid-year disruptions. Plan on some of those in the horizon. And that is the other thing is I don't know yet if we're going to stick to the SEPs with only Heidi-Fighty states or if they're going to broaden and open that back up. Don't know yet. That's one of the things that I'm kind of following, and if we get any answers, of course, we'll fill you all in. But as it sits today, remember, OEP is going to end at the end of March, and here just like 6 weeks from now, it's first week of April. Brokers are going to find themselves in many of these states where you have these low income, dual eligible members. And I still am shocked at how many brokers don't understand the Heidi-Fighty rules and that they don't have an election code and they're not just going to be able to enroll duals with the election codes like they've been able to in the past. And so that's a situation to kind of watch is that whole dual Heidi-Fighty ruling as it kind of works its way through.
Well, as it is right now with CMS, there's a few pending cliffs that we're approaching up on, right? It's like you're coming to the end of the road. That's one of them. The other is with the DSTs, the disasters that everyone's been using, legitimate or kind of like a catch-all, has been majorly cracked down. And supposedly as of April, the current guideline is that you're going to have to be able to call into a CMS agent. And now, we've joked about it before. I don't know what necessarily they're looking at and who gives them the power to be like, that's legitimate or not. But I would say I'll be very surprised if there's a lot of those additional CMS contractors around by then to be able to take an additional influx of calls.
Yeah, to that point, I mean, the tone right now is cut and reduce, excess people. So they're not going to have the staffing for that. I've actually had 3 different carrier calls in which we've been discussing that. And actually the carriers themselves, I said, hey, I don't like the way it sits right now where the election code is going to exist, but the consumer has to call CMS in order to use that code, and that a broker or a carrier can't use that election code to do an enrollment. I don't like that. It either needs to exist or just not exist. And I said one of the carriers, could sue CMS and challenge that. None of the 3 that I talked to had the appetite to do that. In fact,
did they tell you to do it? Because that's what last time they're like, well, if you did it, we'd support you. And I'm like,
yeah, I know. Like, I don't want to be the lead plaintiff. I'm sorry. But more to that, I'm okay with it going away. And the carriers have told me, you know what? We're okay with that election code, DST or FEMA, just disappearing and dying, So that was what caused so much of the friction, the fraud, the compliance issues, the plan switching, that particular DST. The one carrier I talked to said that over 20% of their enrollments from April 1st through to the end of the year, over 20% of their enrollments were from that election code. And, what we're all wanting, we collectively, I, as the owner of Agent Boost Marketing, the broker community, the carriers, we want consistency. We want stability. We want to enroll somebody into a plan that works for them, that there's not friction and disruption. We want to be able to have that book of business and that member stay around and be happy for a long. We don't like all the churning and flipping and movement and chaos, and the carriers don't like it either. And so I think all the carriers that I spoke to said, let's just let that thing die. Let's just let that election code just disappear. And I think that's what we're probably going to see.
Yeah, I think that's going to happen as well. A couple of thoughts there. The way that the CMS agents have been taking calls has not really been positive on the ACA side of things, right? That's been the solution, was to call in and let this, third-party person decide if they can change the AOR, the agent of record, the consent to enroll.
Well, and half the time when we would call in, and I actually have call recordings I would listen to, we would call in and ask them, with the beneficiary on the line, us as the agent of record, to the marketplace and saying, please revoke all other, agent of records and permission. Like, this consumer, only want this person to have access to my information. Okay, it's hit or miss. 50% of the time they would actually revoke prior agent of records and access. The other time they wouldn't. And even though you're on the line with the consumer saying they wouldn't, and the plan is still getting switched. Have you, do you remember the South Park clip where he goes into the bank to invest and he goes, and it's gone.
Yeah.
We'll reinvest the earnings into foreign currency accounts with compounding interest, and it's gone.
What?
It's gone. It's all gone.
Well, that's
Gone.
that's how a lot of the ACA policies are. And that's my point with CMS's changes, is they're like, all right, let's add consent. Okay, well, now we added consent. Now we don't have a way of managing consent. So let's shut down the way that you're able to do that through Health Sherpa. Okay, well, now you have to be agent of record. And they change it then. And then they introduce a resume link. And then that doesn't work. And then now they're like, well, let's do a 3-way call. And then guess what's happening now? Now all these bad entities are just calling and having somebody literally pretend like they're the consumer.
And lying.
And
fraud,
I've been telling people that in the industry, and they're like, what? That's happening? I'm like, yeah, do you guys not ever listen to any calls? Do you guys not, you don't ask them to verify any piece of information?
Well, they're asking for their name, their state, and their date of birth.
Yeah.
You can get that off of a lead card, though, or even out of Health Sherpa. Like, you can get it. And so it's like, unless you're requiring like very specific pieces of PHI or like social security numbers or like, then people are going to continue to be able to do that.
Well, my point is you can keep changing the rules, but if you don't enforce the people who are breaking the rules, it doesn't matter what you change them to. The people are still going to break the new set of rules, whatever you implement.
Yeah.
And there's just been very little enforcement. We did just see another big ACA call center got popped today for fraudulent activities and doing that. And so it's like, there's got to be some enforcement and cleaning up of the industry there. My final thoughts were with the DSTs going away, because that is a cliff that's coming up. And my thoughts are, the industry has kind of been broken for the past 4 or 5 years as far as it's evolved into this year-round election. And I think that it's great to clamp down on those election periods, because we all want to have stable, predictable clients. We all want to have healthy LTVs, lifetime values of our clients. Mm-hmm. However, there's some financial broken mechanisms as far as like commissions and getting new agents into the industry, where it's difficult if you can't really enroll anybody or do anything and you get paid a partial commission up front. So I think if we are going to fix those things and correct a lot of the things that we need changed in the industry, there are also some technical and business aspects of the compensation and things like that we need to fix for agents in the industry to make it so it doesn't incentivize and there's not a need for people to always be flipping, always be churning, that there's not those, mechanisms there. Because I think that's a big driver of that activity.
Yeah, but I mean, counterpoint, that's part of the reason that we do very well, because we identify some of these challenges in the industry and we say, hey, we're going to build this opportunity or this solution to kind of curb that set problem, right? So, at the same time, we're very aware of what these challenges are. And again, like, here's our solution to kind of counter that, right? Which has always been something that we've very much benefited from,
Yeah. I just think people are shocked to learn that most legitimate organizations are fine with a little bit more enforcement and of the election periods, right?
Yeah, I mean, honestly, like, let's just say that the FEMA disaster code completely goes away, and you say, "Oh my gosh, Agent Boost, you're going to have you're going to lose 10% of your sales throughout, 7 or 8 months out of the year." Okay, it's fine. It's great, actually. Like, I'm fine losing sales because we don't want just the disruption and the chaos. And if that can go into sustainable, quality business, all the better. you know, it's better for us. It's better for the consumer.
Yep.
It's better for everything. And I would lose sales for better longevity all day long. So I'll leave it at that.
Yeah, there's a couple more cleanup things that we'll have to get to later, but a lot of stuff we're kind of all over the place in this episode, just giving you an update of everything. Good luck finding a title for this episode, Messiah.
Yeah, I'm sure he'll think of something. But anyways, anything else you want to cover before we wrap?
No, I think it's good. There's seems like there's going to be a little bit more solidification of things and the way the industry's heading week by week now. So it'll be interesting to see how as quickly as things are moving right now.
Yep. Last thing I would say, if you're a listener, if you're planning to be at Medicarians this year, we mentioned it before. We'll be sponsoring the broker kickoff party. So, anyways, I'll be around. Mike will be there. Some of our staff will be there. So
come say hi.
Yeah, come say hey. You know, would love to get to know y'all since we'll be rubbing shoulders, you know, at the little kickoff there here next month.
Yeah, and if any of our industry friends out there, if you want to be on the podcast, we're actually going to be shooting live podcasts on the vendor floor and after it closes. So we're hoping to get some good episodes while we're out there.
I've already got a couple scheduled. So yeah, it'll be good. So anyways,
all right, guys.
Catch you guys next week.
Thank you.